Welcome to the World Health Expo for the second series in this series, featuring a 4-day event that featuring you can see the anti-epidemic supplies, medical treatment and technologies, and also biochemical drugs, traditional Chinese medicine, and health management here in central Chinese Wuhan. I'm CGTN's reporter, Jarchine Chou. This is a second of its series, but of course I think this is really a strong message sent by Wuhan because once hardest hit by coronavirus, Wuhan City holds this international event for consecutive years, for two consecutive years. This year it has invited more than 2,000 brand exhibitors from more than 30 countries with an estimated 400,000 visitors, not to see the safe Wuhan, but also to seek opportunities of cooperation in terms of what the organizer advocates, a community of health and a future of technology. We know that the region back in January was in a really serious situation of COVID-19 and was put under lockdown. So actually, we could say that the city has been suffering great losses in its history. And at this ceremony this morning, actually, many leaders from Asia and European countries expressed empathy to Wuhan people, and they also expressed their gratitude to Wuhan people for what they've done in terms of curbing the spread of the virus. And also, actually, I talked to Mr. Gareth Hoare, the British Consul General in Wuhan, about what Wuhan went through and what he sees now when he comes back from England to Wuhan. So let's hear what the UK official says.
Wuhan once the lockdown started, but that was of great concern to me because Wuhan is my current home. I joined the diplomatic mission, the consulate in Wuhan in September 2018. So I was very well accustomed to living and working in Wuhan. I've made many friends. And of course I was very concerned about my colleagues in the consulate as well. So my impression from London was of sympathy towards all the people in Wuhan, especially what they were going through in terms of combating the coronavirus, the great efforts that were being made by the central government and the local government to safeguard the health and well-being of people. And I was very, very interested to see their experience around how they coped with the mental and physical pressures on them under a very severe lockdown. I'm really pleased to say that coming back to China, things seem to be much more normalized now. My colleagues had some very interesting experiences, difficult and challenging experiences to relate to me. And although we have had a lockdown in the UK and other parts of Europe, it seemed to be much more severe and stricter here. So it took a mental well-being toll on them. But they've come through it, and Wuhan is now in a much more positive light, both economically and socially. And I'm really pleased to be back and working here and looking forward to the future for the things that we can do together.
For audiences just tuning, we're now live streaming from Wuhan's International Expo Center for the Second World Health Expo. And now I'm in one of the 12 venues of this expo, and I'm now in a very special demonstration about how Wuhan was coping with the COVID-19 back in January, actually. You can see 3 different type of protective suits, actually. From this way, of course, this is for medical staff, and I think this is not for the red zone or the contaminated zone. But actually, I just wanted to tell you, because we CGTN crew came to Wuhan to report the COVID-19 since January, and back then the city was, of course, for the unprecedented epidemic. The dire situation for the medical staff was the lack of resources. So they are not quite okay with the actually suits because you know the unprecedented, or we say that unpredicted virus was actually unknown to them, and they have to sometimes they have to wear this kind of suits for 8 hours for a shift. So, and in January actually we were not advised to go into that contaminated area because we don't want it to consume their supplies. But actually because of the task force sent by the central government, actually more and more medical staff with and with more production capabilities from some manufacturers, then could later meet their requirement for the medical supplies. Actually, I think the camera is going so fast, and actually, so this is for CT scanning actually because in the meantime, for the COVID-19, actually the medical institutions were also in difficulties to do the massive testing, or say the nucleic acid mass testing for the COVID patients. So then we know that the Health Commission, the National Health Commission, then also advise the new diagnosis plan to introduce the CT scanning for the patients actually. So you could see that there was a spike of confirmed patients. And we're now entering the ICU, or the intensive care units. So according to the statistics, about 80% of the patients, they had the complications, which means that actually besides the COVID-19, some of the patients have other conditions, for example, like the heart attack. So what we've seen is these beds actually. When we are talking about beds, actually, it is also another sources that the Wuhan city was in lack of, because during my report, we know that people are just concerned about the lack of hospitals. There could be just daily cases in Wuhan would be up to like 700 averagely. So in this expo, the organizer just have this 4 special booths for the demonstration of how Wuhan was coping with the COVID-19. And where we are standing now is the ICU part. And we know that there are a lot of equipments that actually, we know that Wuhan is really good at the healthcare capability, but still for the unknown virus and for the unprecedented epidemic, it is still a challenge. And as we talked about, the medical staff coming from across the country, they are not only coming to Wuhan to support the health crisis, they also brought their equipments. And now we wanted to go to this part. I think this is another solutions that the Wuhan government had. So we can see 2 parts of the hospitals, one in blue and one in white. And this is the temporary hospitals that the government decided to build because of the lack of the hospital beds, as we mentioned. And they were also built within like 2 weeks. And together, these 2 hospitals in the outskirts of Wuhan provides together about 2,600 beds for the crisis. So I just wanted to introduce more background of this because in January, actually, I think it is the darkest time for this epidemic happening to Wuhan. And so in the early February, the government decided to do the mass screening, which means that they wanted to screen out all the patients, all the possible patients. So then they would send those patients to not only just hospitals, as we visited the designated hospitals where they have the fully equipped devices to treat the COVID patients. But at the same time, they want to screen out patients and then send them to the temporary hospitals. So here we are. Other than the two major temporary hospitals, we also have Fangcang hospitals in Chinese, but it's also the converted values into those temporary hospitals. And this Fangcang hospitals also has been a really good example for most of the countries which had been hard hit by virus. And here we can see some books here, because I think some of the, for example, like English journal Lancet also spoke high of the Fangcang idea. And so this is how the Fangcang was constructed, how it was operated. So this manual has been translated into 28 languages, and now it is really popular among medical institutions. So once we also see that the values in different countries would be converted into the temporary hospitals to treat the COVID-19 patients. Here is just like a sample of what we saw back in January and March. So most of Fangcang hospitals back then accepted the mild symptom patients. So the community service played a really important role, because the community workers would knock the door one by one to help them to inspect their temperatures. Once their degree were advising them that they had to do the isolation, or they wanted to be treated here at the Fangcang hospitals, and they will be sent to the nearest Fangcang hospitals. So some of the patients, when they were discharged from the Fangcang hospitals, even they were mild symptoms, they will be doing the 14 days quarantine before they going back home. So now let's go to the disease control and prevention booth. So talking about control and prevention, Wuhan has been a real example, because let's see, because as we see that for the priority things among the governmental issues, for new audiences, we're now live streaming from Wuhan's International Expo, the World Health Expo. So this is about epidemiology investigations. So when Wuhan lifted the lockdown in April 8th, there were some asymptomatic cases, which means that they did not show the symptoms, but actually their testing came out positive. So they're still infectious, as experts say. So it's still happening, because it's still happening. God. So the Health Commission back in April started to report the asymptomatic cases on a daily basis because of these cases. So this is also another aspect of the Chinese government's dealing with the disease control and prevention. So now let's go to the community prevention. As President Xi Jinping just called this community prevention as a second battlefield, in addition to the hospitals. So we can see this blue vent actually is quite popular across communities. It's not only just appearing in front of the community. Actually, when I was in Beijing, actually, I think some of the vents would appear also outside some of the public places. For example, the schools, because this is for temporary use, and people come to these public places would use their mobile phone to scan this health code. So Chinese government decided to rate places for risk for 3 categories. They have the low risks, they have the medium risks, and they have the high risks. So the low risk would be, of course, okay. So your health code would be green, and for the medium risk it would be yellow, and for the high risk areas, when you travel there, and then your health code would turn red. So when you scan that health code, and when the health code turn red, and then you will be guided to this vent, and the health expert or the volunteers would help you do the further check. So, in the beginning of the epidemic, because of the lack of the hospital beds, actually, we know, excuse me, some home quarantine is advised. So when people are doing their home quarantine, I think the camera would stay far away because the TV amplifier is really loud. So I have to screening now. So this is kind of necessities for the home quarantine. Of course, the nursing masks, I think this is really necessary. The disinfection gel, the wipe, of course, the thermometer. And there is a note, because when you are doing the home quarantine, you are supposed to note every day. You are supposed to note your temperature on a daily basis. And once the temperature is about 37.3 degrees centigrade, Celsius degree, then you are supposed to report yourself to the community. And then, of course, the community workers will help you, send you to the temporary hospitals if you are the mild symptoms. But if you are severe and you have the serious symptoms, of course, you will be sent to the designated hospitals. As we said that in the beginning, the hospitals cannot provide enough beds for the surging numbers of the patients. So that's the reason why the government decided to invest the beds, invest the temporary hospitals. So, of course, as we mentioned, that the manufacturers were ramped up. The manufacturing were ramped up during the epidemic. So now I'm going to visit one local major manufacturers who played a really important role to help the medical relief. So let's go. And by the way, excuse me for today's live streaming, actually, because of the louder amplifier, I have to screaming. And my throat really hurts. So let's meet Zoll. Actually, Zoll Smart Manufacturer was among the major manufacturers providing supplies for Hubei region. And now let's meet the president of the manufacturers, Mr. Wu. So Mr. Wu is the president of Zoll Smart Manufacturer Group. So let's just ask him to tell us a bit more about what Zoll did during the epidemic here in Wuhan, and how will the manufacturer be doing in the near future. So 吴总，您简单的跟我们介绍一下，就是说在疫情期间，我们卓尔在武汉本土的疫情方面所发挥的一些作用。
好的，我们在疫情期间呢，主要做了3项工作，一个呢是全球采购，我们在全球很多国家呀， 采购了有1000多万件医疗防护用品，到武汉来，到湖北来，这个捐赠给湖北。那么我们第二件事呢是建院增床。
So I would shorten this name as Zoll. So Zoll, the first thing Zoll did during the epidemic was procuring medical supplies from across the world, and because, as I said, that the country was kind of like in lack of medical resources, and also we know that a lot of countries in the beginning actually helped China to relieve this by donating a lot of medical supplies, especially masks, like from Asia, from other Middle East countries, also from European countries actually.
然后我们第二件事呢是，我们联合这个医院做了7个应急医院，还有3个方舱医院，一共呢有将近8000多个床位，救治了有7000多人。
So as we mentioned about the Fangcang and shelter hospitals, also Zoll also joined in this effort. They have created or they converted about 10 hospitals and providing about thousands of beds, and then they save about 7,000 lives.
然后第3个工作呢就是全球抗疫，因为在疫情期间呢，像很多国家都帮助过我们，所以呢我们呢也向日本、新加坡、厄瓜多尔、法国等国家呢捐赠了500多万件医疗防护用品。
So in return, actually, Zoll also wanted to thank you for those countries' help. So their manufacturing capacity can then meet those demands of donating actually to other countries. For instance, Singapore, Japan, and also France, and to help them to fight this virus.
对，作为一个企业吧，尽我们的最大努力，为我们国家和全球抗疫做出我们的贡献吧。
So actually, I would like to continue ask President Wu about what could be the highlight on Zoll's Expo this year. So 您接下来给我们简单介绍一下这一届展会。
好。
除了刚才说的一些特色东西，还有哪些值得可以跟我们大家介绍的？
好。我们这一款呢是艾灸机器人。艾灸机器人呢就是用中国的中医技术来给我们的病人来做诊疗。
For those international audiences, you may know acupuncture, the Chinese way to help the rehabilitation. So actually, mostly it is manual, and the President Wu is talking about, the intelligent or so robot to help you to do the Chinese acupuncture.
好，你像这个，它这个里面呢装的就是艾草，是诊疗啊。
So some traditional Chinese medicine would also be used in this machine actually, which is wasteful, I think.
好，像这一款呢是我们做的无人机，那么它是这个4轴8个桨的无人机，可以荷载20公斤，用于我们的一些包括医疗防护用品的运输。
So this UVA actually unmanned aero vehicle actually is used to help supply the medical supplies actually. Actually, outside this expo, previously I saw some aero vehicles also made by Zoll. They are also used during the epidemic to provide medical supplies to remote areas or some places that are far-reached.
像比如说，像这个呢，它就是我们的一个这个药品分拣的一个机器，自动分拣的机器。
So of course you can obviously see that this is a kind of machine to help sort out the medicine.
对，它可以根据这个药品的形状和颜色来进行分拣，简化我们的人工劳动。
So it can sort out by different shape and colors. I wanted to mention for our audiences that actually during the fight against the virus, I also heard that there is also a machine invented for sort out the traditional Chinese medicine, because you know that the traditional Chinese medicine would have a lot of ingredients, so they would have different percentage to treat the patients. So they also create those kind of similar machines to sort out the different ingredients or medicines. So 还有些什么？
我们的医疗防护用品。
So of course, Zoll actually is really famous for manufacturing those medical gears, those non-woven fabrics, and I learned that for the Zoll manufacturing capacity later in this epidemic fight, actually, they can provide almost 60% of the local usage. 差不多。这边我还想特别的，就是有一个特别有意思的问题，我突然想问啊，就是因为我们中方的这个抗疫，其实在3、4月份得到一定控制，因为通过3个月的抗疫已经得到一定控制之后，我们的物资已经能够大量的满足，尤其是湖北地区的使用。那个时候我们国家开始给其他的国家提供一些产品的时候，其实我们发现就是。不知道是什么情况，会有一些外国的舆论呢，就是说我们中国的质量，中国的提供的口罩啊，中国提供的防护服可能不过关，他们有一些抱怨。您作为这样的一个就是防护服的这种材料的这种企业家，您有什么想说的吗？ So I wanted to explain that there might be some concern or question about made in China medical supplies when China just put those epidemic more under control after 3 months, and Chinese government also donate medical supplies, for example, masks to European countries. But actually, there are complainations about the quality. So I'd like to ask President Wu to share what he thought.
我想这个可能有多方面的原因。首先呢是，当时这个疫情突如其来，应该说我们中国呢。 也是缺乏医疗防护用品储备的。
So actually, 您继续吧，把这一段说完。
也是缺乏这个储备的。然后，那么在这么短的情况下，我们这个很多企业那么也是为了缓解我们中国的疫情，同时呢也抓住这个商机那么有大量的企业是新产生的企业，他们对这个医疗防护用品的生产呢。 它的标准呢，可能把握并不是很准确。
So, President Wu said that because of the epidemic was actually unprecedented. Actually, there are a lot of manufacturers coming to this market. They may not clear about the quality or standard, so there might be some space for them to grow. Actually.
然后这另一方面呢，就是。 我们中国的这个医疗用品的生产许可、注册许可它的一些标准跟我们欧洲的 CE 的标准、美国的 FDA 标准呢，会有一些差异。
And the second reason is that there might be some difference from some difference in the approval or certificate of the industrial index. Actually, for example, I know that some of the masks could. Meet the demand here in China, and they also okay with the national standard, or 国标 the national standard, but actually it cannot be qualified or it is not equal to those standards in European countries.
但是我觉得这个后来呢，应该是得到了很好的解决。你像我们国家的这个商务部、海关都有了白名单制度。 那么对我们的出口的标准呢，进一步来要求，特别是我们中国的医疗防护用品对接欧洲、欧美国家的标准呢，有了标准，所以呢，有了一个白名单制度，这个呢就很大程度上解决了这个问题。
So actually, this problem was kind of solved through the cooperation between Commerce Department and Customs. Also, they advise they advise a list for those manufacturers which would be qualified to export their medical products. 大概就是这样，是吧？
是的。
行啊，非常谢谢您。我觉得
谢谢您。
可能我想说的就是说，这次这样的一些大规模的这样的一个展会，我觉得对我们中国的企业来说，也是一个很好的更走向世界的一个舞台。因为我们知道这样的一个世界展，可能我们有很多的这个欧洲的国家的、美国的，我们知道这次有34个国外的企业，所以其实我们的产品的这样标准可以更好的跟国际接轨。
对。
其实我觉得这次您就这样的一个平台来说，我们的卓尔在展位上的这种国际合作，目前大概是怎样的一个情况？我简单说一下。So I think this expo also provide not just a platform for the domestic countries, domestic enterprises. It's also a platform for all the manufacturers and health organizations to come to share with their ideas and also to make their further cooperation. So my question for President Wu is, what will Zoll do in the near future?
像这次展会上，应该说我们提供了一个很好的一个国际交流合作的平台。今天呢，我所看到的，像有美国、法国、德国的一些客商，那么到我们的医疗防护用品来咨询，希望能够采购我们的物品。
So it's a really good news that more and more foreign countries, including the U.S. and France, are interested in your products, meaning that Chinese made in China products are okay. They're in quite demand of your products, right?
对，像我们的这个机器人的智能产线，我们的药丸分拣系统，还有包括我们的艾灸机器人，也有一些中东国家、亚洲国家的来咨询，希望我们在技术上面和产品上进行合作。
So actually, there will be some potential cooperation, not in this high-end technologies, but also some other potential cooperations in the near future. Thank you so much. 谢谢您，吴总，非常感谢。So, well, it's really good news to see more and more Chinese companies are working closely with those international companies, and I think. Some exhibitors that I talked to this morning also say that this expo has its far-reaching significance because, this is not only just because Wuhan just is reviving from what it went through. This provides another opportunities for the city to prove its strong capacity in this health industry. So I think it is rolling back to economic and social development. So, and also it is promoting the public security cooperation and also build, as what we talked about, a community of health. So this is CGTN's reporter Jarchine Chou live from the Second World Health Expo. And we will bye for now. I hope to see you next year.